Hi, I'm Jason Conaughty. I'm an orthopedic spine surgeon at Tri-State Orthopaedics. Today we're going to talk about cervical disc replacements as a treatment option for patients that have injuries to the discs of the cervical spine. Patients with cervical disc injuries often present to the office with severe neck pain. They may present with numbness and tingling in one or both of their arms, as well as shooting pain into the arm, which can sometimes be associated with significant weakness in the arm. After a patient sustained a disc injury in the neck or the cervical spine, oftentimes they undergo a trial period of non-surgical care, which oftentimes is very successful. This trial period of non-surgical care typically involves rest, anti-inflammatory medications, also involves typically physical therapy with traction on the neck, which oftentimes can be helpful. And in folks that are not responding to these treatments, sometimes those patients will undergo epidural steroid injections in the cervical spine to try to alleviate symptoms from the injured disc. Most patients undergo a 6-week trial of non-surgical care before we consider them a candidate for cervical disc replacement. The ideal patient for cervical disc replacement is a patient that's undergone an injury to a cervical disc, has failed non-surgical care, and would like to avoid a fusion surgery and maintain motion at the level of the injured disc. This non-fusion option was designed to decrease the stress on the neighboring discs that often break down and become symptomatic in the future for patients that undergo fusions. The surgery can be performed as a same-day surgery in select patients. Some patients will spend one night in the hospital. The recovery time for the surgery, typically for the first 2 months, the patients are not allowed to lift anything heavier than 20 to 25 pounds. No collar is needed. And after the 20 to 25 pound lifting restriction is lifted at 2 months, the patients have no restrictions. For more information on total disc replacements, please call us at Tri-State Orthopaedics.